Okay, let me push it live on Facebook. What is going on? It's not going live on Facebook? Hang on a second. Continue. Sorry. Give me 1 second here. I'm going to pause. Jamie, give it just 1 second here for it to work. And hey guys, can you see us? Oh, there we are. Great. Awesome. Hi, everyone. I am really excited and thankful that Jamie Oskin took the time to be with us. This is Dr. Oskin out of Arizona. And Jamie, I was telling them that we work a lot in advocacy work. I think you're one of the first people I met in the broader homeopathy community at that conference in Arizona. You came up and said hello, and yeah, I remember that. So anyways, tell them a little bit about yourself. And you're recently a dad, right? That was kind of a really exciting thing. We were so happy for you.
Yeah, well, my son next week will be 1.5 years, and we have another one due in the fall.
What? I didn't
know. Yeah. So it's exciting. It took up, my wife and I had, it took us 6 years to get pregnant the first time. So yeah, we're really excited and grateful.
Awesome.
So yeah, a little about me. So I actually struggled with health problems as a teenager and young adult, and was actually really obese, and was pre-diabetic in my early 20s. And I actually went back to school to do pre-med and then go to naturopathic medical school. And it was kind of like along my journey was like a journey of self-healing, actually. And so a lot of that was with nutrition, which is a huge passion of mine that I do with patients. And then in school, I also fell in love with homeopathy. And so I studied a lot of homeopathy in school, and finished and did a residency. And after I finished the residency, I did an selective extra year residency, the only one in the country, specifically in training in homeopathy. And it was in those early years that I really fell in love with helping kids. It seems like, we go to medical school altruistically to help others. And it was kind of like along my path of self-healing, I wanted to learn how to help other people along their journey to heal. And when I was seeing different patients, of course, I have patients of different ages. A huge portion of my patient population is developmental pediatrics and autism. And something about that age group just called to me. And I remember when I was early in practice, I had just finished my residency, and I was just starting to hang a shingle and go out and practice. And I had this case with this 22-month-old little boy who was language delayed and had had 15 rounds of antibiotics for ear infections in 22 months. And he also had ear tubes. And despite the fact that he would get ear tubes like every 3 or 4 weeks, the kid was getting an ear infection. It was like the ear tubes and the antibiotics would treat the ear infection, but they didn't actually help the child heal, so that he stopped getting ear infections. And the most amazing thing happened. We treated him with a homeopathic medicine, and he started getting better. And I think within the first 6 months of treatment, he had 1 ear infection when the family was on vacation at Disney, and they didn't know to call me. So they ended up taking him to urgent care. And that was the only other antibiotics the kid has had. And he went from being language delayed to language excelled. And basically never had ear infections again after that. He's now, the kid's a teenager, because that was probably after I finished my residency. I'm thinking like 2010-ish, maybe. So a long time ago. And that case really struck me, because it was so special to see this little child who was struggling to then really thrive with his health and thrive with his language development and that kind of thing. And I just think about what the trajectory of that child would be like if we hadn't had the opportunity to help him, right? So kind of like the way things kind of serendipitously happen, I felt really passionate about helping kids. And then gradually over time, you know, how it is you help one family and they spread the word. And so more and more kids started coming my way, which worked out well because I liked helping kids. And the cases started to become more challenging. So gradually I started to get referred more and more cases of autism. So I've been doing that for over a decade, maybe even, maybe even close to a dozen years by now. So that's kind of like the story about how I got into it. And
I didn't know that about your background, about your nutrition. I didn't know that, Jamie. That's a really amazing story. And you know, it's just really like sincere how you appreciate, you know, that. Now tell me something real quick, just because I don't know if the people in the group will know this. Is it common for all naturopathic physicians to be this versed in homeopathic medicine?
It's not actually. It's a great question. So in naturopathic school, we learn lots of different health modalities like acupuncture and herbs and nutrition. And homeopathy is one of those therapies that we learn in naturopathic medical school. We're actually the only licensed doctors in the United States that have homeopathy as part of our training. So that's kind of good to know, because naturopathic doctors actually have the medical side training, but we also have the homeopathic training. On the other hand, there are a lot of naturopathic doctors who are not particularly interested in homeopathy or don't pursue it as an area of specialty. And so for me, I did a lot of extra training in homeopathy, both while I was in school and then during my residency, and that specialty residency in homeopathy. That was an entire year of that. And then after that, I've gone on, I volunteer. I'm currently the president of the Homeopathic Academy of Naturopathic Physicians, and I have a specialty credentialing DHAMP, which I'm not saying to brag about, but basically what I'm saying is that just is a designation so that if you're looking for a doctor who's a naturopathic doctor and you want to find a doctor who maybe is really taking the time to be an expert and credential themselves an expert in homeopathy, you may look for those credentials after their name, DHAMP, which means that they basically have been board certified as a specialist within the naturopathic profession in homeopathy.
Gotcha. So they're a naturopathic physician and they specialize in homeopathy. That's great. Yeah, I think those credentialings are they're really meant for consumers to be able to identify someone with quality experience and training, and that's really great. Very good. Okay, so tell us a little bit. You know, we are doing this live because people in my Facebook group specifically requested it. They wanted to learn more about, you know, the value of homeopathy on the spectrum, and you know, basically tell us a little bit about doing this for a decade. You know, what do you have to share with us? Maybe some cases to start with.
Yeah, absolutely. So I would say homeopathy is holistic. And so we help the whole child heal as a whole person. But to give you an idea of some of the things that we can most help with, speech delay is one of the biggies. I've seen that over and over, that we've been able to help many kids with speech delays. Not 100%. And I think certainly as I've gotten to be better in my craft as a doctor over the years, I've been able to help more patients. But speech delay is a biggie.
Okay.
I just had one literally at 4 o'clock today before this session today, the first month. This is a little 3-year-old girl who's not talking, and she's now in ABA therapy and speech therapy, like repeating all the words that they're giving her. She's not yet having back and forth, but for 1 month, the parents are super happy, right? So we tend to see that pretty consistently. And I've even seen speech improve in even teenagers or people in their mid to late 20s. It may be slower when the kids are older and more gradual progress than if we are able to help the child when they're really young. Okay. But it's still possible. So speech, sensory processing things, there's like no other good therapy outside of like occupational therapy, which I haven't seen be amazing, but homeopathy is one of the best therapies for sensory processing disorders. Sensitivity to bright lights, clothing textures, touch, smells, loud noises. I was just reading back before this, one of my patients who's been a patient of mine probably going on 9 years. And this was a
Wow.
little boy. Now he's a teenager. He's like he's bigger than me. He's like a big teenager. And he was in elementary school when they started seeing me. And he's on the autism spectrum, and he's come a long, long way. Now he volunteers at the fire station. And I was reading something the mom wrote that I had totally forgotten about, which is that she wrote about how afraid she was to go to Disneyland because of all the loud noises and the smells and the sensory things. And because of working together, now they like go to Disney almost every year, and he tolerates it just fine. And it brings a lot of joy to him and the family. So sensory processing, that's a biggie. Tantrums and violent behaviors, we often can have really remarkable progress with, to make, along with, sometimes it comes along with anxiety or OCD or some other issues going on that we can help. And social interaction. So for example, like that little girl that I just talked about, she, in the first month of treatment, she's starting to repeat words, but she also has a baby brother that she used to basically completely ignore, and it was as if the baby brother didn't exist. And she couldn't care less about the baby. And in the past month, the mom said all of a sudden she's like doing things like bringing the baby a raspberry, or trying to pick the baby up to give to the mom. And it's like all of a sudden she's rejoining our world. Autism literally means to him or herself. And so like they're, kind of like the idea is they're kind of in their own world, right? And now it's like this child's brain is healing and re-entering our world, right? And showing interest in other humans. So it's really, really heartwarming. So improvement in social interaction. The other thing I would say is that homeopathy is holistic. So when we help a child with the core autism features, we look holistically to select the individualized medicine for each unique child for what else is going on in the case. So if a child has like skin rashes or seizures, or lots of kids on the spectrum have bowel problems, either constipation or diarrhea. Those are things that are also very helpful to us, that guide us to the selection of the homeopathic medicine. And recurrent ear infections, like the little boy I told you before, allergies, all those things we take into account with our prescription. And we expect that as the child gets better as a whole person, that not only do the developmental delays like speech delay, et cetera, get better, but also things like their skin rashes, or et cetera.
And just so you guys know, like I have my cell phone out because I'm watching, the comments, and Chrissy's going to be helping me, but we will be taking questions. So if you write your question in here, we will be getting to them. So that's amazing. I think it's very, fills you with hope, because it does seem like with other modalities, it's so hard to get any progress with autism, for sure.
Right.
And I know it's probably been traumatic for a lot of people, the masking with their child with autism, because that's a huge sensory thing for them, right?
Yeah, not only that, I saw it with my own son, who's at the stage of language development, and he walked really early, but was slower in his language development. And it drove me nuts that at preschool, I'm sure there's lots of opinions out there with COVID, people have different things, but one of the things that really affected me was worrying about my son's language development, because he walked early, but his language was delayed given how fast he walked, right? And it drove me nuts that all the teachers were masked. And we know there's actually now pretty ample scientific evidence that that period of development is critical for kids to see facial expressions and read mouths, to actually learn the mechanics to mimic speech, and not only the auditory part that they can't hear as well through a mask, but so anyhow, it is hard. And I've had heard so many stories that the pandemic was rough on families, with a kid at home trying to learn from an iPad when their child really needed so much more support than that. And so that was pretty heartbreaking. But I'm hopeful now that we're past a lot of that, and kids are back in school where they can get the most nurturing and love from their teachers, and etc.
Yeah. So someone's asking, we're talking about autism specifically, but it doesn't matter the disease condition. If you have someone with Down syndrome that has sensory issues, if you have someone with, someone who regressed during COVID, like we're talking about autism because someone, not someone, but our group requested that specifically. But does the diagnosis matter very much?
Well, a diagnosis is helpful for prognosis, but in terms of which means like what can we expect from treatment, but the diagnosis doesn't necessarily make an impact in terms of what we want to help. So, for example, you could have a child who's not on the autism spectrum but has, really intense sensory symptoms, or let's say they have ADHD and sensory symptoms. So we can help those things too. We just individualize the homeopathic treatment to those each individual case.
Right, exactly. That's right. And yeah, okay. And so I love these stories of these kiddos that when I was over in Washington, D.C., you told some really interesting stories of just how challenging it is for you as a practitioner to select the right remedy, but then follow through the case. Something that I've really been working with my group, Jamie, to help them understand. I believe that parents get very obsessive about finding the right remedy, and they'll look through materia medica. A lot of them are looking for conditions that are chronic, which I really am trying to help them understand, like the value of working with a homeopath, because it's not just finding the right remedy, it's case management. So it's both, right? It is the right remedy, but it's also managing through that remedy, and then the progression of it's like the whole arc. Can you maybe share like that arc a little bit, and where that management really comes in and is valuable to parents?
Absolutely. For something as complex as autism spectrum disorders, I really want to echo Paola's recommendation that it's best to work with a trained homeopath that's really both is very knowledgeable about homeopathy, but also has experience with the spectrum disorders. So, for example, no, all good. So, for example, I shared some cases at the conference where, let's say a child came in and a child who I treated maybe for 5 years, let's say, they came in and this child was really violent, nonverbal, etc. We started treating with homeopathic medicine, and things started improving. The violent behavior started going down. The jealousy towards the siblings started going down. The outbursts started going down. He started to make more verbal attempts to speak, etc. But with homeopathic treatment, there's often like 2 steps forward and then 1 step back, and then 2 steps forward and then 1 step back. So it's our job, the homeopath's job, to help look at the trends and then make a decision going forward how to manage the case. And what that means is oftentimes we need to adjust things. So we need to adjust often the potency of the medicine, and sometimes we need to change the medicine completely to a new medicine. So if the symptom pattern changes, we change. And that happens over time as a child kind of progresses through the healing stages. They may start with, like when that child started, he started with a remedy that he needed at that time, which was he was in this violent state, right? And as the restlessness and hyperactivity and tantrums came down and the violence came down, those were no longer the main problems or concerns that the family had. And so then we started shifting to other areas, like let's say the anxiety and the sensitivity to noise became really prominent. Then we had to shift gears and help that. And so working with someone who can help you with that is really helpful. The other thing that's hard as a parent is it's very hard as the parent to both be the observer and the prescriber, because you almost want to jump every time you see something new. And what my job is to do is to take a step back and look at the overall trends. I don't get too worked up if there's any one good day or bad day, but I'm looking for the trends. That overall, is the child making progress, or is the child getting worse, or did the child improve for a while and is now getting worse? And now that tells me I need to, if all things are the same, I just need to adjust the potency, and then usually healing starts happening again.
Yeah, I mean, I recently experienced this with my own homeopath. I was on a remedy, and I won't tell you guys what it is because I know you're gonna know all my secrets. But I was on it, and I was on it for 2 months, and meaning like I only took it a couple times during those 2 months. And actually, a lot of my old symptoms came back. I've had really bad hormonal insomnia, restless legs. Like, it didn't come back as bad as it has been, but it came back, and I was like, oh, I'm totally on the wrong remedy. It's got to be bad, whatever. So I met with my homeopath just this week, and she was just like, actually, you just need a higher potency. This remedy is stimulating things for you. We just need to go to a higher potency. Like that's just the beauty of case management. And she's totally right, and it's totally helped. I'm sleeping better again. So it is really amazing kind of how like when you are the parent, you're so close to the situation, you can't see the forest from the trees. And someone here is asking, like, you don't strictly only treat people with autism spectrum disorder. Like if someone has ADHD or PANS and PANDAS, like you work with anyone. You just tend to have a lot of people that come to you with the spectrum.
Absolutely. I actually, I was trained in family practice, so I do see a variety of concerns. I would say a huge percentage of my practice is kiddos on the spectrum, but I also have other kids with other developmental concerns. And I do have some PANDAS patients. I treated many of those quite a while ago. There's another wonderful doctor who used to be a student of mine and is now like very successful in her own right. And is her name is Jennifer Barr, Dr. Barr. She's also credentialed as a DHAMP homeopathic specialist. And she has a very excellent practice for PANDAS. So most of the calls we get for PANDAS, we send to her. She refers the autism cases to
Yeah,
us.
I reached out to her. I'm like, can you talk about autism? Because I forgot that she just does PANS and PANDAS. And she was like, have Jamie speak. And I was like, okay, great. So
and that's a great relationship, because the more specialized we become, the more we can help those families. But but I do have still some cases that I've had for a long time. And to tell you the truth, I have some cases where I help multiple people in the family, because you're like, I had one yesterday where it was like, I treated the daughter, they're twin daughters. I treated one of the daughters for like 2 years. She got so much better the first year. The mom said, can you help me with all these menstrual problems and this and this and this and joint problems? I said, sure. So then mom came and we treated her, and she gets like dramatically better. And then like, they're both my patients, and she says, my other daughter really could, can you help that? And it's like, yeah. So
actually, yeah.
So kind of like it's like a family affair. And as the family gets healthier, obviously everybody gets healthier. But and sometimes it helps with the parents. Being a parent of a child with special needs is very, very stressful, and it's emotionally stressful, it's financially stressful. There's a lot to it, right? And so often when the parents are in good health, right? Like, what they say on the airplane, right?
Yeah, put your
oxygen mask on first, right? So it's like almost like when the parents are more resilient to the stress and in a healthier state, they're also better able to cope. And so it's a great environment for the child too, right? So that is the case. But for sure, a very large percentage of my practice are kiddos on the spectrum.
So tell me, if you could, tell us the case that I heard at the conference. And out for the record, I get bored to death at conferences. I'm always like, oh my gosh. And I'm always in the back sleeping or multitasking or whatever. People are always like, are you ever going to go to homeopathy school? No, I am not. So, but I was very moved by this case of yours. It was the one where this child's father was deployed. And I thought that was such an interesting case, and really highlighted the individualization. Like autism, you might have remedies that perhaps you use often for sensory things, but we can't like protocol,
Mhm.
these conditions. Like it's very, very specific to the person.
Right. That's a great question. So it's a fascinating case. This is about a 15-year-old boy who's a current patient in my practice right now. And as kind of like a preface to that case, let me just say that I think that my personal belief is that autism is a biological disease. Like, it's not just a psychiatric disease, even though the diagnosis sits in the DSM-5 psychiatric manual. There's actually like things going on in the brain in terms of neural pruning, inflammation, et cetera, that cause developmental changes in the brain. And some kiddos seem to be that way. They seem to be delayed from birth. Other kiddos seem to develop normally, and then something happens and they regress. Okay. And it is really heartbreaking when that happens. And I've seen cases where it's like an infection. The child gets a really bad infection and a high fever, and then they seem to regress after that. Or I've seen cases where they have a really terrible vaccine reaction and they have a super high fever. They start rocking their head and rocking in the corner and banging their head, and the child's never the same afterwards. And that's not to say that, all kids with autism have vaccine injuries, because I've seen many kiddos on the spectrum that weren't vaccinated at all that still developed autism. It just seems that certain kids are sensitive to certain environmental factors. So to Paola's point, this was a child who was developing along and started to maybe show some initial signs of regression, but then it was speaking some. Dad deployed to the military, and the child was like, first of all, the child didn't understand it because it's too young to understand. And it was devastating to the child. And the child would cry and kept like running around asking where dad was, and just like went off a curve in terms of development, and speech went away. And this was like Labor Day weekend. The kid's like 15 now, so it was probably about 13 years ago, 12, 13 years ago. Labor Day weekend, dad deploys. By just before Thanksgiving of that year, the child had regressed so much that was completely nonverbal that mom took him for an autism diagnosis, and he was diagnosed severely autistic. That's how fast the regression happened. The dad comes home, and for a month from the deployment to try to figure out what's going on, and all of a sudden he starts talking again. He says, "Daddy," and it wasn't perfect, but it was like some of the losses came back. Then dad had to go back after December, so the beginning of the year, and then the kid tanked again. And by March, when dad came home, the damage was done, and by that point he was like fully autistic and
Doesn't click
really,
out on his own. Yeah.
yeah. So when we prescribed the homeopathic medicine, even the child was like 15 when he came to see me. So this happened years prior. I mean, he was
Oh my
like,
gosh, I didn't realize that from the presentation.
yeah. He was like I think 2 when dad was deployed. So so much earlier. But with the speech delay, we took into account into the individualization of the homeopathic medicine. The factor was the triggering, we call it etiology, but the triggering onset to the regression, this emotional, really it was like a grief, like a lost love. If you can imagine a 2-year-old, if a 2-year-old had a parent die, or the child can't comprehend it, but it's like this amazing grief to miss the father and not know why, and how that's when the language regressed. So that we took that all into account with his homeopathic remedy, and he's making strides. He's he's no longer running away from home. He's starting to speak more, speak in longer sentences. And this is for a 15-year-old. So now the changes are slow and gradual and steady, but mom's definitely, they're marked enough that mom, this is another one of those cases where mom said, after a few months, after he's getting better, I have another son who's also on the spectrum, but isn't as severe. He's more high functioning on the spectrum. Can you help him too? And so, we tend to often help multiple people in the family. So, definitely I've seen even in older teens, we can see improvement in speech delay and that kind of thing. But what we expect for a teenager is slow and gradual progress. For a really young child, when we get them when they're really young, like the 3-year-old I was just telling you today, 1 month already, she's repeating, things that,
A little more dramatic.
yeah, it tends to be, not always, but tends to be a quicker response when we get the right remedy.
Gotcha.
We don't always hit a home run right out of the chute. Sometimes it's a little trial and error to find the right remedy, right? And so we have to be patient with that. And so, in case we don't get it right from the start. And sometimes we hit a bunch of singles or doubles and move the child's development along. But over time, you go a year, 2 years, 3 years, and you look back and you say, wow, we've come a long way. And I've had numerous cases, especially those younger kids where they weren't, let's say they're speech delayed or what have you. And when I get them really young, I've had several cases where if we treat them starting around 2 or 3, by the time they're in kindergarten or first grade, they're mostly mainstreamed in school, with maybe some pull-out extra services or classes. If you didn't know they were autistic, you probably wouldn't know, but you may realize that the child still has some quirky tendencies and may have some areas of cognitive delay, but otherwise gets mainstreamed in a kindergarten class. And I've had several cases like that. So when we're able, it's kind of typical with all autism treatments, but especially with homeopathy, early intervention, we can see the most dramatic changes. But I never lose hope, even with an older child. I had one earlier this week, a young woman who's, I think, in her 30s, early 30s, and the sister helps with the follow-up visits. And the sister was like, we're seeing gradual improvements in cognition, but first of all, she's been way less argumentative and easier to deal with. So the family has eased the burden on the family, the stress level in the house. But she said cognitively, she said, you know what, like my sister has never understood money. And she said the other day I saw her counting money for the first time. So even the brain is what we call neuroplastic. It has the capacity to heal and change over time. And what's amazing to me with homeopathy, like I don't know if I would have thought this, a dozen years ago when I started helping kids with autism, but now I don't lose hope, because even someone in their 30s I've seen make cognitive improvement, even if it's slow and gradual.
So when someone asks a question, can we find out what he would recommend for regressed speech in a 14-year-old boy? So this is the kind of question that we're trying to help that he couldn't answer, because there's so much that you have to. I mean, how long is that case taking appointment? Because mom didn't walk in, like the little boy who was 15. And his dad had been in the military. Mom didn't walk in and say it started when his dad went, like that was years ago. Like mom has so much information, and your job is to figure out what to prioritize and what not to. So
yeah, you're exactly spot on. So every case is individual. I always say, if you've met one child with autism, you met one child with autism. And the fact that it's a spectrum disorder basically tells you, they lump kids in a box with this diagnosis because you meet so many criteria that says now you got the rubber stamp and you can call it autism, this thing called autism. But in my experience, it's so limiting because every child is unique and special. And for me, every case is unique. And I may have some remedies that I use that I've more commonly seen in my experience to be helpful in certain types of cases, like sensory cases or speech delay cases, et cetera. But every case is unique and different. And so that first visit, we schedule 3 hours with me. Now, when people want to become a patient in our practice with me, they start actually with an interview with my colleague, Dr. Haller, who's a co-worker in the practice, partner in the practice. And she actually sits down and has an hour-long conversation with folks to actually hear what's going on and see if we're a good fit. Like we don't want you to be investing like 3 hours of your time or any time at all if it's not like, if we don't think we can help you, right? So we're really serious about getting results and helping families and helping kids. And so part of our process, you'll spend an hour with Dr. Haller just to kind of get the gist of, yeah, what are we looking at in terms of a treatment plan and prognosis, and is this a good fit to work together? And then when you get to, by then, if she kind of feels like it's a good fit, then we move forward, and then you'll get on my schedule, which sometimes takes 3 to 4 weeks to get on my schedule. But then that's when we have like a 3-hour visit. So I take really, really long time. And I was reading something a parent wrote that said something like, and this was an interesting case because this is a case from 2011. And so it tells you a case from a long time ago. Now this young woman is probably in her 20s, and she was maybe 12 then. So, and the father was a pediatrician, and the mother wrote about how they had seen, all these different doctors, all these different specialists. They'd seen psychiatrists. Their child was on antipsychotic medications and had gained 60 pounds from the side effects of these medications and everything. And she actually wrote this kind of testimonial saying how I was the first doctor to listen to every detail about her daughter, from the smell of the sweat on her feet to her reading delay to her speech delay and everything else. And we really do try to take the time to be very, very thorough in that regard. So we take that very seriously.
Yeah. And then you mentioned earlier, this is a question that came up a little while ago. You mentioned earlier that, you're very passionate about nutrition. And so how much of a role does nutrition play in the overall journey?
It's a great question. I think nutrition is really, really important as a foundation for health. It kind of is like the building blocks. You are what you eat, so to speak. So the building blocks for the brain and that kind of thing are all really important. I had a new patient today who was grossly deficient in multiple nutrients: vitamin D, B12, folate, grossly deficient in omega-3 fatty acids. We need omega-3 fatty acids for brain development, right? And when I see a kid, I had a patient on my schedule today, a little girl who's autistic, who eats chicken nuggets breakfast, lunch, and dinner because it's the only food they will eat, right? We see this a lot with kiddos that are really like, they can be OCD, really rigid, and so they are very restricted in their foods. And so we also have health coaches. We work with parents. Health coach, we have an excellent health coach that's actually has a child on the spectrum herself, so she's really well versed at helping families, and so those are things that make a difference. So now the homeopathy is always like a baseline treatment, and I think one of the most important treatments that we offer. But as a baseline of health, if a child isn't getting any fruits or vegetables, or they're only eating all these processed foods with really bad oils that are damaging and inflammatory to the brain, right? They're not getting the other really good healthy fats in the diet, right? We work with families, and we also work to coach them, especially for super picky eaters. How do we expand the palate gradually? And that can take time. Like I have 2 of those cases I presented at the conference Paola was at, are cases I've been treating probably 5 years each. They're siblings. And the mom is amazing and has changed the diet completely of her kids, who used to have a complete junk food restrictive diet. And the kids definitely responded very quickly to the homeopathic medicines, but over time, it took like a year before, she looks back and she says, it took a year before my child would eat cauliflower, and now they eat cauliflower regularly. So we started seeing changes quickly with homeopathy, but also sometimes when we see the changes with homeopathy, we also see a more flexible child willing to eat more variety of foods, and vice versa. Sometimes, we see improvements in nutrition that support the child's foundation overall. If you're going to build a house, you want it on a strong foundation. So the other thing that we do is we customize all our treatment plans. So if a family already comes to us and they're already doing all that stuff, they've already done the nutrition, they're great there. We're not gonna focus that in our treatment plan because it doesn't really apply to you as a specific child or a specific family. I had another family recently. They're only Spanish speaking, and I'm so excited. We have another doctor in our practice who's fully Spanish speaking, and so we teamed up. Like I took the case and she translated for me. And this little boy, it's been 2 months, and he's starting to talk more. He's starting to interact more. It's super exciting and fun. But the other thing that about that case was that the diet was really, really poor, really primarily processed foods, very picky, limited eater. And so we've been gradually helping mom, and it's slow. We're not expecting them to change their diet overnight, but we already are seeing some progress with the homeopathy, and it gives mom a little more resilience to then
to pick those battles.
And the other thing we've done is given her support. Not only do we have our health coaches, but we paired her up with another mom who's a successful has been a long time successful patient of ours who's done a really good job to change nutrition in her house. That's also Spanish speaking, so that we can make sure that that mom had the support she needed in her household. So that was really, I think, has been really helpful in that case.
Right. Okay, so a few questions here that we had submitted, that people submitted ahead of time. Are there general remedies to consider for the fight or flight response, perfectionism, always seeing themselves as a victim, not able to take responsibility for themselves, or if there aren't general remedies, what rubrics are helpful in these situations?
Yeah, I mean, it's a great question. It's hard to answer in a forum like this because every case is so individualized. But if there are certain things that trigger the OCD behaviors, or certain things those can be very, very helpful. So for example, I was discussing this case earlier in the call where the child was very violent, and it was due to jealousy. Anytime the parent gave any attention to the sibling, that the autistic child lashed out and beat up the sibling, right? So those individual triggers help us to pick up rubrics. So in that case, we would look at remedies that are aggravated by jealousy, right? But another child could be having tantrums for different reasons, maybe because they have a tummy ache and they're constipated, or because they have sensory sensitivities to loud noises, or et cetera. So those things all have to be highly individualized. And so we can't say in general that there's like one remedy for these things, but there's maybe like a group of remedies that's common with, let's say, aggression. And then there are subvariants. So there's certain remedies with aggression, and then you have the ones that also have sensory symptoms, constipation, and et cetera. And that's how we individualize and find the right individualized medicine to each child's needs. Yep. So I hope that helps answer the question. I think there was another question on toilet training. I don't know.
Yeah, let's do that one. I might have missed it because I know actually, I have friends whose children have autism, but it's just toilet training is definitely something I'd never thought about until I heard your presentation at the conference. But yeah, let's talk about that.
So I have had numerous cases improve with toilet training, and some like 6, 7, 8 years old. And this is a really, really big thing for the family. I think I presented some cases at the conference where the kids were, I believe, 6 years old at the time I treated them, and they were twins and not potty trained. So if you can imagine the stress as a parent with 2 kids on the spectrum who are not potty trained at 6, that's first of all a lot of diapers, but it's just really, really a lot of stress. And within a few months, those boys both potty trained. So it's possible. Now, and I've seen it repeatedly. I don't have a specific remedy or remedies for toilet training, but in my experience, what I've seen is that when we get the right remedy for the symptoms of the child's development as a whole, and we start to see improvements in speech, etc., all the other developmental delays kind of come along in gradually improving. So if they're delayed in speech and all of a sudden you get that going, the other areas of delay like potty training start to come along, and they're more in our world, so they're more aware and interested, start showing an interest in using the toilet, which maybe in the past they hadn't done. Or I think I presented another case at the conference where it was that little boy who is violent and jealous, and he never used to kind of notice when he had a wet diaper or needed a diaper change. And within the first month or two, when he started improving as a whole person, he started to go to his mom to tell the mom that he needed a diaper change. And that was the first sign of showing interest or awareness of his bowel habits. And later he actually did fully potty train. And I think he was.
Well, that's what they say with toddlers. That's one of the first signs, is you're supposed to wait and to potty train them until they show interest.
Yeah, and a lot of times in kids on the spectrum, if they're not yet potty trained, it's a developmental delay because they're not yet showing interest. And all of a sudden, when we start stimulating the healing process and the brain starts healing and they start going through those developmental stages, they're just delayed. So now you have a 7-year-old going through a developmental stage that maybe a neurotypical child would go through at 2 or 3, and it's delayed, but they're still going to go through that stage. So it's really, really fun to watch, and it brings a lot of relief to the family.
Yeah. Okay, so I have a question. Did you hear about how the CDC moved the benchmarks for developmental delays? They moved them back. Did you hear about that?
No, I actually should know about this, but I didn't.
Yes, you should. The CDC changed the benchmarks and lowered the bar so that it takes longer now for kids to reach their developmental stages. It used to be that they got them younger, now they pushed it back. What do you think about that?
I have to read more about it, but it doesn't seem right to me, is my gut feeling. The rates of autism are exploding. When I was born, it was 1 in 10,000. Now it's like 1 in 42, I believe. So it's think about that. That's like one child in every 1.5 kindergarten classrooms is diagnosed on the spectrum. And some of these kids are mild, but a lot of them are really severely autistic with really severe delays. And if you go back to when I was in school, we just didn't have that many kids in special ed. The incidence is way higher now. So there's something wrong in our society. There's something making our kids sick, or what I would propose is multiple things. There are many environmental factors that are impacting our kids, whether it's the food we're eating or the pollution or vitamin D exposure or the age of the parents, or there's just so many factors. Now there was just a new study came out about 2 months ago with TV, and the more hours a child sees TV in the first year of life, exponentially goes up the risk of autism. And it makes so much sense because the way, if your brain gets wired to look at a screen and not wired to interact with humans, it will wire that way. And we see a lot of these kids that are like magicians with an iPhone at a young age and know how to find all these weird things on YouTube and can't look someone in the eye or have a conversation, right? And so we're literally like poisoning a generation's brains with screen time before the age of 1 in critical periods of neurodevelopment. So, I mean, like my wife's family thinks we're fanatical, but we don't allow my son to watch TV. He can listen to like Pandora music, but there's no TV on in our house when he's awake. And we want him playing with toys and looking at books and that kind of thing. And so that's really important. So there's so many different things. And I think it's multifactorial. What are the different environmental factors that can affect the child's brain development. But, this gets into one of the other questions that was in your feed, Paola, which is, what do I think about heavy metal detox? And, I'll tell you, I'm cautious with it. I'm very, very cautious with it. I don't do it myself. I much prefer homeopathy because homeopathy is safe, gentle, effective. And that's just how I roll. But when I was in school as a resident, I was studying with another doctor who's head of the pediatric department, who actually did the first study between our school, SCNM, and ASU, looking at chelation in autism. And they did find that certain kids who did a pre-testing that were high in heavy metals actually had some benefit from the chelation therapy. And but not all the kids across the board. And certainly if the kids didn't test to have high heavy metals, they actually didn't show clinical improvement. So my first advice is, if you're going to go down the heavy metal route in chelation detoxification, you have to do it with a practitioner that knows what the heck they're doing, because it can actually be dangerous. You're like pulling all these toxins out of the body, and things can flare up. It also, I counsel parents not to do homeopathy at the same time as that, because it screws up the case and makes it really difficult, because the kids get all, as all these toxins are being pulled out, all their symptoms flare up, and then it makes trying to treat them homeopathically a nightmare.
Right.
It's much easier to just treat them homeopathically and gradually allow their bodies to heal and detoxify on their own. And I'll be really, really honest. I had one experience that just kind of like broke my heart, but also made me not want to do chelation in practice, which was when I was a resident. I was helping this other doctor. They were doing IV chelation on a little boy, and it took 4 adults. They actually sedated the child with Versed, which is a sedation medication, and it still took 4 of us adults. We were like sweating through our dress shirts, 4 adults to hold this child down so that they could get the IV in. And I thought, why are we giving kids like medicines that are highly invasive, have side effects? They can increase toxicity as they're bringing things out. When we have like such a beautiful, safe medicine in homeopathy. And the thing is, the remedies taste good. So even really picky eaters, like that have lots of OCD and finicky things, they'll take the remedies. So that's just a personal anecdote. It's not to slam chelation or heavy metal detox. I know it helps some kids, and if it's helped your child, that's fantastic. It's just not my thing. And I just tend to lean towards really, really safe, gentle, natural treatments, like primarily homeopathy and nutrition, that kind of thing.
Right. That's very good. I'm trying to see if there's any questions here that popped up in the chat. Okay, so then let's see what else. I'm going to skip the questions about asking about remedies for irregular sleep. I think we've really covered that. This is questions that were posted before this live. So
Sure.
I think we've really covered the idea of, we really need to individualize treatment for a chronic condition. This is coming from one of our homeopaths. Janice is a homeopath in our group that is just so awesome at helping people understand kind of the broad space for homeopathy. And I just have to say real quick before I bring her question up, Jamie, I love how you've done such a good job of helping us understand. Like, I feel like homeopathy has like its pedestrian level, which is like, what remedy is for this, what remedies for that, what remedy is for bruising. Like, it's very, and I don't mean that in a negative way. Like, there's great value in that. And honestly, if the entire society knew how to do that for all the easy things, we wouldn't get to the point probably that we're today, where we're so chronically sick. So there's something about that is profound, but it's very like straight up and easy. My curriculum for the kids, we do keynote prescribing and learning about, especially around accidents. And I think there's really, really good value to that. But, I guess what I'm really hoping for, like, to be a mommeopath, like that's our goal in the group, is to become mommeopaths. It's really to understand that there is like a profound place for homeopathy, and you don't even want, like, I'm at the point now where I have no desire to ask what's the remedy for insomnia,
Mhm.
because
Mhm.
I understand that that's such, like, that's almost like a baby asking an adult how, how do you build a house?
Mhm.
It's like, well, yeah, you put it together.
Yeah.
It's like it's really difficult to answer that, so
Well, it's a great point. I mean, I think every parent should know how to use arnica, for example. Like we have arnica. This morning, I gave my kid arnica before he went to school because he was playing with his bus and bashed
right.
himself in the head, and he had this big thing. And of
Mhm.
course, we don't want the daycare to think we beat our son, right? So we give him
Exactly.
arnica, and then by the time we got to school, the bruise was gone, right? So every parent should have that in their diaper bag. But for really, really, complex
Yeah.
chronic conditions, I really recommend that you work with somebody who's a trained professional that knows what they're doing, because it's a serious thing that we're dealing with, and we want to make sure we give it um, the reverence that it
Yeah,
deserves.
good word, reverence.
And um, so yeah, I highly recommend for something like autism spectrum disorder, you work with somebody who's experienced. And that doesn't take away from being able to do acute prescribing on your own for little things here and there. But I
And
really,
even
really,
some, like, big little things, like, I've dealt with some bigger little things that were a little overwhelming, but we got through. I mean, you can get to that point where you can do some tricky acutes, not complex acutes, but like
Mhm.
tricky ones, and I do well. I think moms can go beyond like arnica, but a wise mother knows when to get help, and when this is
Yeah,
going, if you want to do this well, this is going to be beyond my scope, and I just want my family to be better.
yeah,
I want
yeah,
their families to be better,
for
and
sure.
that's the truth, that's the truth.
Well, what this tells me, Paula, is how much you understand about homeopathy.
Right.
and and certainly I think all the folks that are in your group are way better educated as consumers, and for their health, about what homeopathy is and how individualized it is and that kind of thing. We don't give a this for that prescription. We give, for, like I said, every child with autism, if you met one child with autism, you met one child with autism, because we individualize everything. And
And
they're all
that's
unique and different. And do you mind if so there's something we do with new patients. I'll recommend it to all your group, but I we give every new patient a copy of Timothy Dooley's book called Beyond Flat Earth Medicine. I don't
Oh,
know if you're familiar with that book, but it's a
great
real
book.
short book. And the first edition is free on his website. I can't remember what the website is. I think it's
Okay.
like beyondflatearth.com. Maybe I'll look it up real quick. Um, and beyondflatearth.com. And by and far, the parents who read that book are like so much better um, they're so much better at helping me to
At
do my job,
partnering with
right?
you.
In other words, like we're a team. Like, your kid and you're an expert in your kid, and I know my craft and I'm an expert in my craft, and together we work as a team to help your child on their healing journey, right? And so, but when the parents understand the therapy and they understand what is the information that Dr. Oskin needs,
Mhm,
all of a sudden we become like a much better team, because
mhm.
like a parent who kind of like understands now what I'm looking for, they tell me, they say, okay, Dr. Oskin, Johnny has a cough that started yesterday, and it's really barky and dry, and it's worse at night when he lies down, and especially when the draft of air blows on him from the fan, and it's better when he drinks warm water. And they just like give me all the details I need, and then I say, oh, that's very easy, thank you very much, go, this is the remedy you need, and blah blah blah. Whereas a parent that doesn't fully understand the process for what it is that we're doing with homeopathy and what information the doctor needs in order to help, really it's about helping you and helping the child. And the more we can team together and the more you know what I need to help you, the better job I can do at achieving that. And so the parents who can't quite wrap their head around that, and they just tell me, well, he's autistic, you know, they're all just autistic symptoms, and
Right.
they can't describe what's going on with the child. It makes my job really, really hard. But
The
I think,
decibel level, you know, and you want to become sophisticated.
yeah, and I think so. I think certainly all the stuff you're doing, educating families, is amazing, because then the parents become more prepared when they come for their visits with their doctor. But something simple that everybody could do is read a book like Beyond Flat Earth Medicine.
Oh,
And
I've heard about it so much. I've looked at it a couple times. I need to get it and listen to it. I think it's even on Audible. I'll have to look, which is kind of a big deal for me for it to be on. It needs to be on Audible for me to get to it lately.
yeah, me
Um,
too.
and I have to say, like, you know, this thinking of like, what's the remedy for this? What's the remedy for that? Like, I believe, you know, not completely, because it's okay to ask that, but that mentality is what big pharma has trained us to be and to think. And it's a little
Mhm.
bit of that residual, like so many of us are here because we're breaking away from big pharma. We're trying to get out of that. We're trying to break free from, you know, these systems that we know are bringing disease and unhealth. But when we see someone over and over and over again, what's the remedy for this? What's the remedy for that? That's kind of like the residual traces of big pharma that's still kind of there in your mind, because we're trying to get you beyond that. We're looking at the whole person. We're not looking at the disease. We're not prescribing, you know, based on disease. We're looking at the entire person. And when you can think past that, and you're not thinking, like you said, you've got a cough, but it's a cough that sounds like this, it's better from this, it's worse from this, it starts here, it ends here. You know what I mean? Like all these things, you're seeing all the colors. You're seeing like the
Mhm.
full spectrum of the person, and then you
Yep.
can find the remedy. And I think
Yeah.
that's like we need to break free from being slaves to big pharma.
And
You know,
it's not our fault. It's just how we've been trained to
not our
think.
fault.
This, we give
I've been
this
there.
for that, you know, you take this for that. And but but I think what you're doing, Paula, is such a great service to help families and to help train. I know you call them homeopaths, but the dads out there too, and
Daddy that has
train everybody. And the more we can learn how to be good advocates for ourselves by being good observers and good historians, the better we can help our
right.
practitioner to help us, right? So
Right. Okay, well, let's go back to Janice because I started talking about her, and this can be our last question. I'll check to make sure there's nothing else that I'm missing. But okay. Oh yeah, we're at our hour mark. So when looking for remedies for autistic children, so she's a practitioner, how would you differentiate between what is their personality and what is autistic symptoms that may respond to a remedy?
that's a great question. And really, so I practice old-fashioned homeopathy. I like to say, like, buy the book. You know, if you're, I'm sitting in my office and on my desk is the Organon of Medicine, which is the like kind of manual, the original manual from Samuel Hahnemann himself. And really, what Hahnemann says is we're looking at deviations from health. And so, you know, if there are personality traits that sometimes in chronic disease, it can be difficult to tell the difference between a normal personality trait and a disease trait. But if it becomes excessive, that's when it's no longer serving us. So in other words, I wouldn't necessarily give a remedy to a child just because they're shy. But let's say I have a child on the spectrum that is language delayed and they're extremely shy. I have a case just like this. So the little boy, extremely timid, terrified of the fire alarm at school, would be like hiding under his desk at school, and every day was vomiting before school because he was so afraid that the fire alarm would go off. And like they couldn't get him to go in the classroom, like mom had to stand there, right? Like this level of shyness is no longer like a personality trait. It's like a limiting factor in this child's life. It's no longer serving this child because it's so intense. That now becomes a symptom that we look at as to help being helpful for the remedy. And just so you know, this little boy, he's doing fantastic. I've been treating him for like 4 months, maybe. Speech, 7-year-old speech delay. Speech is doing fantastic. He's like talking up a storm. And he's no longer vomiting before school every day. He's no longer afraid to go to school. He's no longer anxious in school. He's no longer anxious when the bell rings. He's no longer as shy around strangers, right? He may always be a more maybe introverted person, but that's not, to me, that's that normal personality is not necessarily helpful for finding a homeopathic remedy. It's when by intensity or dysfunction, it becomes so problematic to their life that it's limiting to them and causing a challenge or a problem in their life. Now that's something that we look at to individualize and give a homeopathic medicine. And what we see is that it becomes balanced. So like, I like to give the analogy, I know we're talking about personality traits, but I think this one will make sense for this audience, which is sensory sensitivities, right? So all of us need senses. Like, it's normal to hear. It's actually an abnormality to be deaf, right? Or a neurologic abnormality, I should say, not in a judgmental way, but it's a neurologic abnormality to be deaf. And it's also a neurologic abnormality to be to have hyperacusis. What we mean by that is a hypersensitive sense of hearing. And a lot of kids on the spectrum have that, where they're hypersensitive to sound. And what I describe to the parents is it's not bad to have a sense of hearing. But right now, you know, in your child who's on the spectrum with sensory sensitivity, it's like the volume's all the way turned up. And what we need to do is turn the volume down to a more moderate tone that's more healthy. We don't want him to not have the ability to hear. We want him to hear at an appropriate level that doesn't cause him to stress.
So basically, you're not really worried about differentiating between personality versus autism. You're just looking at what are the most debilitating symptoms that we are trying to prioritize.
That's the way I do it. I'm kind of old fashioned by the book, but yes.
Gotcha. Okay. All right. Well, let me see. Children these days have such a connection with technology, and kids on the spectrum even more so. Any cases where it's become easier to manage tech and time and influence of technology. I think you kind of answered this one.
Yes, and I've had some where the meltdowns over taking the technology away actually become less severe. They become less OCD and attached, the addiction. But you have to recognize that the technology is also highly addictive. It's highly dopamine stimulating. And so it is literally an addictive process in the brain, just like cocaine. And so a lot of the kids have tantrums because it's like withdrawal from a drug. Right. But I have definitely seen, especially when it's like an OCD, that they're obsessed about the tablet or what have you, that becomes much more manageable for the families.
Right. Yeah, that's right. Well, Jamie, thank you so much for your time. We're a little
You're
over,
welcome.
but thank you so much. You've been so awesome. Guys, if you would like to learn more about Jamie, I have it here, and Chrissy's going to post it. You can go to, oh my gosh, I have it here, Jamie. Give me a second. Well, why don't you tell them while I find it?
So yeah, if you're looking for help, we would love to be able to help your family. Our website is www.aznaturalhealth.com. That's AZ as in Arizona, naturalhealth.com. And our phone number is 480-456-0402. And if you call and say that you watch this, talk to my team. We like to do pre-education, but if you've already heard this talk, you've gotten a lot of pre-education, so they'll be able to set you up with the initial interview to get the ball rolling.
Yeah. Okay, gotcha. Awesome. And then,
right.
And then also, Dr. Oskin has a Facebook group, Homeopathy for Autism, #4 Autism, and I put the link there too, where he has a series of patient education videos similar to this, but you know, if you kind of want to go on a deep dive a little bit more, you can go there and join that Facebook group, which I think is so awesome. All the homeopaths need to do that so that they can understand their style of practice and everything. So Jamie, thank you so much for being here. You're a wonderful person.
Thank you so much.
I'm so excited about you guys having another baby. I know that was, I was so excited for you when you guys were pregnant with your first. And so just have like a ton of babies now.
Yeah. Well, I'll be happy with 2, but you know, I think like anything in life, things that are challenging are more rewarding when you come to the other side of it. So we're really excited. Thank you so much, and thank you all for listening. And really hope this helps some of you, and that we're able to help your families.
Awesome. All right, guys, have a good evening. Thanks, Jamie. We'll talk to you guys later. Bye, everyone.